Welcome to Jefferson Highlights Community Television. I'm Lori Zook. My guest today is Dr. John Mowdy of the Jefferson Chiropractic Center, and he's here to talk about how chiropractic can work for you. Welcome, Dr. Mowdy. Nice to see you again. Can you tell me about where your office is located and how many years you've been at that location?
My office is located on Route 15 South in the Route 15 South Plaza. We're located in the same parking lot as the post office and right next to the Skylands Bank. At that location I've been seven years now. I started in 1998, and March will be my complete 7 years. Wow.
What's your professional background?
I started off, I actually grew up in the area. I grew up in Rockaway, New Jersey, and I lived in Landing for a while on Lake Apacon. I went to Morris Hills High School, and after graduation from Morris Hills High School, I went on to Springfield College in Massachusetts, where I received a bachelor's degree in sports biology, which is a great degree for futuring on into chiropractic school. I went to chiropractic school at New York Chiropractic College in upstate New York. At New York Chiropractic School, I graduated there in 1996, and after that I went on to get my master's in nutrition at the University of Bridgeport, which is a great degree to have in association with chiropractic.
What inspired you to become a chiropractor?
I was very athletic when I was younger, and I had gone to chiropractic several times, or chiropractors in the area several times, for sports-related injuries. And I like the fact that chiropractors deal with people on a holistic manner with no medication, no surgery, and they look at the body as a whole and treat you as a whole person in trying to, cure your ailment or whatever your problem might be.
Okay, and what kind, I know you said you obviously went to college, what kind of training is required to become a chiropractor?
Chiropractic school is a 5-year degree. Most people who enter into chiropractic school usually have a 4-year pre-med degree, some sort of pre-med degree or science degree, where they get the prerequisites in order to get into chiropractic school. Chiropractic school, being a 5-year degree, is a very intense program, very similar or competitive with medical school nowadays. We get a real large amount of hours in anatomy and physiology, exercise, nutrition, diagnostic skills.
Okay.
And that's
how it works. Is there a continuing education program now that you're a chiropractor? What do you do? Do you continue on by taking additional classes as things progress, in the chiropractic trade?
Yes. Chiropractic, everybody, depending on what school you go to, you learn some different techniques. Now, once you graduate chiropractic school, there are lots of different seminars you can go to in order to future or get more education in the chiropractic field.
Okay.
I have attended several seminars on a specific technique called Cox flexion distraction, which is a particular technique for herniated bulge discs in the back in order to help reduce or get rid of herniated and bulge discs. I also do a lot of, since I have a master's in nutrition, I also have done a lot of school work and postgraduate work on nutrition, anti-aging, and just better health.
Okay. Now, I know that chiropractors have, I believe, been around for thousands of years. Can you tell me about the history of chiropractic, how it came to be?
Yeah, they're back in early Greek and early Roman times. They have Chinese writings and Greek writing about chiropractic, about manipulating the spine to reduce pain, and this was back in 2700 BC. Hippocrates, who was a Greek physician, also wrote about adjusting the spine to reduce pain in the back. But more modern chiropractic has started over 100 years ago with somebody called D.D. Palmer, who lived in Iowa, and D.D. Palmer was a very good anatomist. He was very knowledgeable about the spine and anatomy of the body, and he started chiropractic 100 years ago, and one of the first ways one of his writings in the beginning was about how he cured somebody who couldn't hear by adjusting the spine, by adjusting a specific vertebrae in the spine and getting rid of nerve pressure, enabling that person to hear.
That's pretty amazing. Tell me, I know in New Jersey that chiropractors are considered physicians, but what is it exactly that chiropractors do?
Yes, chiropractors are considered physicians in New Jersey. We don't prescribe any drugs or do any surgery. What we do is chiropractors look at the body as a whole. We work on restoring function to the spine. A chiropractor will perform a specific adjustment or manipulation to the spine in order to alleviate nerve pressure or nerve tension. Our brain is the master organ in the body, and it conducts electrical impulses to every organ and every part of your body through your nerves. And in order, what chiropractors do is anytime your spine is not functioning properly, what we do is we provide a specific adjustment to the spine in order to alleviate that nerve pressure, which enables that proper nerve flow to be transported to the body part so that you don't have any problems.
What type of patients do you see? People who have been in accidents like myself? What are the causes of a lot of the injuries that bring people into you?
We have several different patients, ranging from the very old. My oldest patient was 92 years old to very young. My newest patient is my son, who was just born 4 days ago. He's 4 days old, and thank you. And he just got his first chiropractic adjustment a couple days ago.
Wow.
But we range from everything. Chiropractic, the unique thing about chiropractic, it's very non-invasive. The adjustments don't hurt. You can pretty much perform an adjustment on anybody. And we see all different types of clients, anywhere from auto accidents, sports-related injuries. I treat a lot of pregnant women. During pregnancy, your body goes through a lot of changes, and you can't take medications or drugs, and chiropractic is a great alternative for any type of ailment or back pain or anything you might have.
Okay, and in aligning the spine, does it have an effect on the other organs in the body?
Well, that's the whole theory behind chiropractic, is the nerve impulse from the brain goes out through these nerves and stimulates every organ in the body. And if somewhere along the line that impulse is being hampered or not functioning properly, the impulse is aberrant, what we do is we restore the normal function to that nerve in order that so that the body can heal itself and those organs can heal. We see a lot of people who get good results with asthma, allergies, ear infections, sinus problems. These are some of the things that get pretty good results at chiropractic.
So basically it's all different types of medical problems where maybe a prescription isn't really doing anything because it's something to do with the organ in the body. So what you're saying is that if the spine is properly aligned, then the other organs in the body should function correctly,
yes,
and the person will feel better.
Yes, if you have normal function in your spine, then your body should function at 100% health.
Do you find that older people, due to maybe poor posture as they age, what happens with the discs that makes it so that it's, you see people hunchbacked that are having difficulty walking?
Yeah. Everybody degenerates at a certain or a different rate in health. I see some young people with very bad degenerated spines, and I see some old people that have great spines. And that doesn't really particularly tell you how much problems or what kind of problems that people are going to have. But what we do as chiropractors is we try to start people off very young, teaching them and educating them about their spine and how to keep proper posture, proper nutrition, proper alignment of the spine. Because if you start young, you're going to progress through your years and have a lot better health and better spine.
Right, and you were talking that you helped a lot of athletes. What kind of sports-related injuries do you deal with? Are they all spine-related? If somebody has a problem with their knee, their foot, their arm, can you do adjustments on those parts of the bodies in addition to the spine to help them? How does that work?
Yes, we do a lot of extremity adjusting. I see a lot of athletes with shoulder problems, especially weight trained or bodybuilders. I see a lot of swimmers with shoulder problems. And we do a lot of different techniques in order to get or restore that shoulder back to normal function. And we also see patients with foot problems, knee problems. I most recently had a patient who had been to a doctor with a foot problem, and the cortisone shots didn't help out. And we did some manipulation and some deep tissue work on their plantar fasciitis, and the patient was ecstatic with the results she got.
That's excellent. And you were also saying that you do chiropractic on infants as young as 4 days old. That's amazing. All different ages. I also understand, although I don't know if you do it, that there's chiropractic for animals as well.
Yes, I actually have a friend of mine who lives up in Sussex County, and he owns a horse farm, and he's a chiropractor, and he does equine adjusting. He actually adjusts horses. And there's several chiropractors, and there's actually postgraduate studies on adjusting and manipulating all different types of animals.
That's pretty interesting. Do all chiropractors learn the same types of techniques when they go to school? In other words, if I went to 5 different chiropractors, would they all be doing it, the adjustments the same way based on the patient's problems, or does each person develop their own technique?
Most chiropractors have their own technique depending on what school they went to, but their ultimate goal is to restore the spine to normal function. And whatever technique they use, you know, their goal is to restore the specific area they're working on and get it functioning right so that that normal nerve conduction and flow can go out to the body.
Okay, and you also mentioned that you have a master's in nutrition. Do you incorporate that into the chiropractic center when you're doing adjustments for people that maybe need it? Or do you use other types of therapy, such as physical therapy or massage therapy?
Yes, we always try to educate people on nutrition, because nutrition to me is very key in health and life. If you're not eating healthy, your body's not going to perform or work healthy. So we're always educating and telling people on how to eat properly and do the right thing for their body. At my office, we do have a massage therapist on staff. Her name is Abby, and she's just a wonderful massage therapist. I think it goes hand in hand. A lot of people with muscle tension and stress, if we reduce some of that muscle tension and stress, their adjustments hold a lot better and they get better results. Physical therapy-wise, my background is in sports and athletics, so I try to I incorporate some physical therapy, exercise. I would educate people on proper exercise. And we do some physical therapy, electric muscle stim, deep tissue massage, and stretching in the office to get people to heal quicker and better.
John, I'd like to continue asking you questions on what happens the first time somebody comes to a chiropractor. What can they expect?
All right. When you arrive at a chiropractic office, you're always going to have to fill out a little bit of paperwork, which consists of a history. That's very important in assessing someone's health. History can tell us a lot about the patient. After filling out the paperwork, you're going to sit down with the doctor, and we're going to go over a lot of questions. Things like, you know, obviously assessing your chief complaint, what's causing your problems, where it's coming from. We're also going to get into some stuff about your history, what you do for a living. A lot of times we'll get into some nutritional questions, because with certain ailments, like, for example, headaches, can sometimes be caused by dietary stuff. So we want to really find out what's going on with your history. We'll ask questions like, have you been in any previous auto accidents, any previous injuries? We try to go back as far as possible to even, like, maybe when you were a kid, to find out some of these things might have been caused years ago, or you might have had a trauma years ago that might be causing your problem today. So we go into a really, really deep history on what is going on and where this chief complaint might be coming from. What we also do is we'll do a physical examination, and like any medical doctor's office, we're going to do some orthopedics and neurological tests depending on what your condition is and what's going on with your body. We do a good structural analysis. We always like to palpate the spine to find out what's going on with your spine and how the alignment is in your spine. Chiropractors spend lots of student hours learning how to palpate and learning how to diagnose conditions of the spine. A lot of times chiropractors will do other tests, x-rays. The whole goal with your first visit is to assess whether or not you're a chiropractic case or not, and whether or not I'm going to be able to help you with your specific condition. Chiropractors these days tend to work a lot with other medical doctors, physical therapists, and we all work together more than ever nowadays. People are understanding that chiropractors and medical doctors can work together. So if you're not a chiropractic case, I want to find that out through the history examination and send you on to maybe an orthopedic or your medical doctor. But chiropractic can usually help in most cases.
Okay, and what is the popping or cracking noise that you hear when you have an adjustment?
Yeah, the old dreaded crack. That is, the cracking or popping noise is just gas in the joint tissue around the joint. And what happens is when you bring the joint to a range of motion through an extreme range of motion, that gas is sometimes released and will come out in a cracking or popping noise. The chiropractic adjustment is very safe and non-invasive. We treat very small patients to elderly patients, and the chances of anything happening in a chiropractic event are very rare.
So I understand that sometimes people are very nervous if they've never had an adjustment before. So I'm sure there may be viewers watching who we're going to be showing you doing an adjustment on these so that people can see that it's actually pretty simple. But do you find that there's a big fear for first-time people who don't know what to expect?
Yes, some people come in scared of the chiropractic adjustment. They say, I don't want to be popped or I don't want to be cracked. But not everybody, we don't have to crack or pop everybody. There's other adjusting techniques that we can do in order to realign the spine or get the spine functioning as optimal as possible. The cracking and popping is it's just a sound, it's just a joint. And some people actually, after they get that, they express a lot of relief and say, oh,
right.
that was the best pop I've ever had, or they really enjoy the cracking noise.
How often do people have to go to the chiropractor? Is it based on their individual case?
Yes, it depends on the person in the case, whether they're chronic or acute. Usually an acute stage, when people come in, say they've thrown their back out shoveling. We've had a lot of snow recently. We get a lot of people throwing their back out shoveling. That was what we call an acute case. And sometimes under acute, when there's a lot of inflammation and the joint isn't moving or there's a lot of spasm in there, it's hard to provide an adjustment to the joint because the joint is in spasm and it can hurt a little or be a little tender to adjust. So we have to do some physical therapy stuff beforehand in order to get that joint loosened up and moving properly so that we can get the proper adjustment on there to alleviate that nerve pressure.
Can you talk a little bit about my case? Because as a chronic pain person who had an auto accident about 10 years ago, I seem to have permanent injuries, and I'm sure there are other people watching that think they have to live with such a severe amount of pain because oftentimes medication doesn't work in cases like mine. Can you talk a little bit about what you can do to try and help alleviate pain?
Yeah, we see a significant amount of patients who've had auto accident or previous accidents and have chronic pain, and over the years they've been taking medications, and I'm not anti-medicine. Some people take medicine and it does help a lot of people, but over long periods of time you really want to try to get away from that type of treatment and treat your body as a whole and get it functioning and working better. But we see a lot of people with chronic problems, and we try to work on it, take the patient as a whole and do a little bit of everything. Physical therapy we can do, electric muscle stim. We do a lot on yourself, for instance. We do a lot of deep tissue work to get the muscles because you get a lot of spasming due to the old accident. When that nerve gets pinched or gets impinged, you get a lot of spasming in the area. So we work on loosening up that area first before the adjustment. They're doing so we can get a better adjustment out of you. Everybody's different. Chronic patients, some people can just get away with just being adjusted. And it really takes some time in learning what specific is the best thing for that patient. And we go through a lot of examination and analysis in order to find out what the best treatment process or the path is to get that person better. Exercise is always a good thing. At-home stretching is always, we're always educating and talking to people about proper exercise, stretching. Even with people lifting properly, you find so many people that still don't know how to lift properly, or even bend properly. They say they were lifting something to put in the back of their car. Anytime you extend something heavy away from your body, you're putting your spine in a compromising position. So we try to teach people to lift properly and do things the proper way. Therefore, they don't have acute episodes. The chronic person, you want to try to keep away from having acute episodes where they're in excruciating pain. You want to maintain their body and continue it in a good healing fashion.
Great. Well, thank you for answering my questions. And we'll be back in just a moment where Dr. John Maddie will show what a chiropractic manipulation looks like. Welcome back to Jefferson Highlights Community Television, where Dr. John Maddie is going to demonstrate a chiropractic manipulation. Please don't try this at home.
Thank you, Lori. All right, a little bit about Lori's case. Lori was in an auto accident about 10 years ago, so she has some chronic problems with her spine, preferably or more so up in this right upper shoulder area and neck area where she has some nerve impingement, which she's had for several years. She's tried lots of different treatments for it, lots of different types of modalities. She currently sees a massage therapist that she's been seeing for about 8 years, and she also goes to regular chiropractic visits. More recently, Lori was lifting a 50-pound bag of dog food, which she probably shouldn't have been doing by herself, in which she hurt her back this week. So Lori's a good case to be working on today because she has some stuff going on in her spine. Always with a patient, we always assess their spine first to see how their spine is doing, and we do that through motion palpation, where we feel the joints just to see how they're moving. And I can tell right away, just by feeling Lori's spine, that she's much tighter on this whole right side, in the right thoracic area here, even all the way up into these muscles here called the levator scapula, and this muscle here called the trapezius. Now there's a lot of nerves that flow out of the spine in this area, and if any of those nerves are being impinged, that can cause problems down the arm and into the hand, and that's one of Lori's symptoms. Lori tends to get a lot of numbness and tingling and pain into her upper extremity on the right side. So before we do any kind of manipulation on Lori, we always do some deep tissue work or some trigger point therapy in order to loosen up this tissue. I find that by loosening up the tissue, we tend to get a better adjustment, and the adjustments tend to last longer. So what I'm doing right now is just some what can be called acupressure or deep tissue massage. And we're just trying to increase the blood flow to the area. By increasing the blood flow to this area, it brings in good blood that helps flush out any kind of toxins that might be caught up in this area. Toxins like lactic acid, which is a byproduct of muscle contraction. When these muscles build up with a lot of lactic acid and byproducts, they tend to get very stiff and tense. And none of this stuff is painful we're doing on Lori right now. Is this very painful, Lori?
No.
Some people actually, the harder we press, tend to say it feels better.
Yes.
Good. We're just digging in here nice and deep, trying to loosen the whole area up. Our ultimate goal is to relieve the nerve pressure, which Lori's having down her right arm. And I can feel right here in her trapezius muscle that it's very spasmed up, very tight, what we call hypertonic. Alrighty. We're also going to check down here is what we do as chiropractors. We like to check the whole spine. So Lori has been having a little bit of trouble with her right sacroiliac and low back. So we always check out these joints too. We like to make sure the whole spine is in good alignment. Just going to go down to the end of the table here. Just by looking at Lori's legs here, I can see her right hip is rotated a little. So we're going to perform an adjustment on her right hip along with her upper back. So we're going to start off with a little thoracic adjustment. We're just going to apply a little pressure. Sometimes the patient will hear some popping or a popping noise. And like I said earlier, I explained that that's just gas in the joint. Take a deep breath in and let it all the way out. Good. Good. Alrighty, we're also going to do a little adjustment to the low back here. Alright, Laura, I'm going to need you to lie on your left side and just face me this way.
Okay.
Do this. We're going to leave that down there without bringing it. And this is called a side posture adjustment. And it's very non-invasive, and there we go. Go ahead to the other side, and we heard a popping noise there. That's just the gas in the joint. We're going to do the same thing on the other side of the table here. Just to loosen up this lower back and get it functioning properly. Go ahead, lie on your back, Lori. Thank you. All right, now we're going to go move on up here to the neck. A lot of times in the office, we always do a lot of stretching to keep everything loosened up and functioning right. People tend to tighten up a lot in the neck due to stress. Everyday stresses, whether it's work, household related. Good. Do another little stretch here. And there's no pain on this. Right now we're stretching a muscle called the trapezius. And we're going to also stretch a muscle called the levator scapula, which is considered the stiff neck muscle. A lot of times when people have stiff necks, that's the problem. That muscle can be causing a problem. Good. All right, now we're going to perform a little manipulation on Lori's neck here. And do a little adjustment there. Perfect. And one here. Good.
Good one.
All righty, can you sit up for me, Laura? Come on up. All righty, and that was a chiropractic adjustment. Thank you very much, Lori.
Great. We'll be back in just a moment. Thank you, Dr. Mowdy, for answering all of my questions today. If anyone would like to contact you, how can they reach you? Do you have a phone number or an email address they can contact you at?
Yes, my office phone number is 973-663-3733, and my email address is jmaute, M-A-U-T-E, @verizon.net. And consultation is always free, so people are welcome to call my office and for information or anything I might be able to help them with.
Very good. Thank you very much.
Thank you.
Thank you for joining us on this episode of Jefferson Highlights Community Television. I'm Lori Zook.